All right. All right, Tim.
Thank you so much, Beth. And what we are going to do now in the space of 5 minutes is to try to get some context about healthcare and how healthcare can interact with schools, and especially around the area of transition. And so to do that, I just want to sort of orientate you to what some of the different ways healthcare is used in schools. So next slide. What you probably are most familiar with is the idea of special education. So special education in Wisconsin is designed to meet the unique learning needs that require specially designed instruction. So children go through an assessment, and to receive special education services, they will then be placed in one of the 12 disability categories. And so once a child is identified as having unique learning needs that require specially designed instructions, they are in the special education program, and then they receive an individualized education program, which is an IEP. Next slide, please. And so for students in Wisconsin, what our Department of Public Instruction says is that those requiring special education, the IEP supports access, engagement, and progress in academic instruction at all grade levels. The department developed guidance on writing IEPs called College and Career Ready IEPs, improving outcomes for students ages 3 to 21. So any student who is in special education has an IEP. It is supposed to be a college and career ready IEP from age 3 through 21. And so those goals in the IEP are focused on helping that child be college and career ready. So it's focused on having them achieve a level of performance, a level of function that will then help them succeed in what they want to do after high school. Next slide. So they break the CCR, College Career Ready IEP, Individualized Education Program, into a 5-step process: understanding the strengths and needs, identifying the effect of disability on achievement and performance, sorry about that, develop goals to achieve and support that child, align services, and analyze progress. The one that I want to focus in on is 3 and 4, which is the developing the goals to achieve and support. So obviously, if we are looking at children succeeding in high school, post-secondarily, developing goals around healthcare so they can manage their own healthcare, understand their own health, be able to utilize the healthcare system in a way that keeps them healthy, can be a goal within that school environment, because it will lead to success. And I would say it's foundational to those students' success. And so then aligning services is, we may not be able to do everything within the school. Let's utilize the expertise of people that may not normally be part of the IEP team, the school nurse team. Let's bring in the school nurses. Let's bring in the school psychologists. Let's talk about primary care. Let's get the therapists talking together. That is the aligning services part that is in the IEP. Next slide, please. And so far you'll see that in Wisconsin, when we have the healthcare transition, we are really getting aligned with transition and healthcare. Now, IDEA is the federal law, and what they say about transition is they want transition services to be a coordinated set of activities that promote movement from school to post-school activities, including education, employment, adult services, independent living, or community participation, and when appropriate, acquisition of daily living skills. I believe that under the IDEA and what they're looking for in transition services, that healthcare firmly lands within the ability of independent living and community participation, as well as daily living skills. And so I see a direct correlation between healthcare transition and what the IDEA is telling us the schools need to do with transition services. Next slide, please. And so just to review, the IEPs, all IEPs in Wisconsin are supposed to be college and community ready, college and career ready. Transition planning in Wisconsin begins at 14. We have a dedicated group called the Transition Improvement Grant that helps guide and support schools in transition. They have actually developed a post-secondary transition app to help students, family members, schools, community members to start that transition planning. It's a very easy to use app. The link is on the slide, and we'll get the slides sent out to you that anybody can go in and work through. Next slide, please. But IEPs are not the only way that healthcare interacts with schools. There is also the individualized healthcare plan, which is probably the plan that a lot of the school nurses are familiar with. These are for needs that may result in an emergency or need for management or monitoring. So think your chronic conditions here. So these are developed in response to a healthcare need that is going to affect safe and optimal school attendance and academic performance. So again, it's tied into the school environment. Linked to the blank generic IEP form is there, but a lot of people may be, next slide, please. A lot of people may know IAHP, Individualized Healthcare Plan. They may actually be using an emergency action plan or a care plan. The most well-known in Wisconsin is the Asthma Action Plan. And so this is a collaboration. These plans are collaborations between the medical provider and the medical team outside of the school, and then the school inside the team to establish what is the basis of care and what is going to happen in case of an emergency in the situation of asthma for the Asthma Action Plan. But they could be used for any sort of healthcare need, including other chronic conditions such as diabetes, seizure, and anaphylaxis. Next slide, please. And then there are students that are not covered by chronic conditions or by special education. These students are covered by Section 504 of the Rehabilitation Act of 1973. And so anybody with a disability is covered under the 504. So these students could still get accommodations, and they still may have healthcare needs that will be affected, that the school nurse can get involved in the 504 plan, as well as the outside aligning with those outside agencies. Next slide, please. So in summary, why does this all matter? This all matters because students don't graduate from having chronic conditions or healthcare needs. These are lifelong conditions, because we believe that self-determination matters and decision-making takes knowledge, skills, and action, and that we can use the time in school when we have the children in a supportive environment to promote self-determination after school. So this is just, again, a really quick overview of healthcare as it may look in school. This does not even touch on the school-based health clinics that may be there and the school mental health system that may be there. But hopefully this gives you a context as we learn what DC and GOT Transition worked on. Thank you so much.
Tim, thanks for the intro and the reminder for all of us for that, where IEPs and transition meet. I have the esteemed pleasure today of introducing our speaker for the next 40 to 45 minutes. I'd like to introduce you all to Samhita Ilango. Ms. Ilango joins us today from the National Alliance to Advance Adolescent Health, where she works as a health research and policy analyst with our esteemed transition colleagues, Margaret McManus and Patience White. She works there assisting with healthcare transition research and quality improvement activities in the District of Columbia and nationally as part of the National Alliance's GOT Transition efforts. Ms. Ilango is a California native and tells us she's in sunny San Diego today. She completed her undergraduate work at the Johns Hopkins University in Baltimore, Maryland, with a Bachelor of Arts in Cognitive Science and Anthropology. She went on to receive her Master of Science in Public Health in Health Policy and Management from Johns Hopkins Bloomberg School of Public Health. Ms. Ilango has a diverse background that brings her to this work, including research work with several prestigious organizations, including Johns Hopkins, the Kennedy Krieger Institute, and the Bill and Melinda Gates Institute for Population and Reproductive Health. A quick Google search on her name will reveal a brief college career in fencing at Johns Hopkins back in the day. Definitely somebody I'd like to have in my corner if needed. For myself, as a parent of a 10-year-old child with Down syndrome, and in my work as a school board member in my rural Wisconsin community, I understand the importance of Ms. Ilango's work with healthcare transition and our country's educational system. Please join me today in welcoming Ms. Ilango to our learning call for the opportunity to learn more about her work in a different region through GOT Transition. We hope that her experience might help to spark innovative research and project ideas here in Wisconsin. Welcome.
Thank you so much, Julie, and thank you to everyone for having me today. I also forgot that I did fencing, so that was kind of a nice reconnection with my past. So like mentioned, I'll be talking about the importance and integration of healthcare transition in school settings. And if you have any questions throughout this conversation today, please drop them into the chat or feel free to email me afterward. My email is listed below. It's silango@thenationalalliance.org. Next slide, please. So GOT Transition is a program of the National Alliance to Advance Adolescent Health, and we are funded by the Maternal and Child Health Bureau. Next slide. So today we'll be focusing on 4 objectives. The first objective will be to discuss and understand a bit of the outcome evidence related to healthcare transition for youth with special healthcare needs. And then I'll be diving into some of our pilot projects in DC, focusing on several pilot projects that occurred in school-based health centers, as well as in school mental health programs. I'll then identify a few of our latest tools that relate to how healthcare transition can be incorporated into special education programs. And at that time, I might even share my screen if that's okay and give you a walkthrough of where these tools are located on our website. And then we can discuss how healthcare transition activities can be promoted in the planning and educational goals phase. Next slide, please. So just a bit of background information. I know a lot of you are probably familiar with the National Survey of Children's Health, and the data here is actually from 2018 and 2019. However, last month, at the beginning of the month, the new data came out. So the new data for 2019-2020 is released. I'm sorry, I haven't updated it in this slide, but nationally, only about 23% of youth with special healthcare needs are receiving transition planning guidance from their healthcare providers. So not that many. Similarly, there's a low rate for youth without special healthcare needs. Right now, it's about 17%. And if you didn't know this, the questions used to understand the measure on healthcare transition in the National Survey of Children's Health, we have listed the 3 questions below. The first is a measure of whether the doctor spoke with your child privately without an adult in the room during the last preventive checkup. The second question is if a discussion about transition to adult care was needed, was needed and whether it happened. And finally, they check to see if a doctor actively worked with the child to gain skills and understand the changes that happen in healthcare. So like I said, this information has actually been updated, and you can check it out for your own state. The website childhealthdata.org is really user-friendly, and you can see not only your state, but you can break up the results based on different demographics using their tools on the website. So feel free to check that out at any time. Next slide, please. So what is the evidence for a structured transition process? Well, our team has done a couple systematic reviews looking at literature between 1995 and 2016 and from 2016 to 2018 to tell us what really is out there and what is happening. So it has been found, according to this literature, that there is statistically significant positive outcomes for youth with special healthcare needs related to population health, experience of care, and utilization. I've listed out the examples specifically more below, but I'll also note that for utilization, the measures right now have not evaluated clinician experience or cost effectiveness of healthcare transition. But in these other areas, there is a wide variety of evidence to show that healthcare transition does help. And if you want to read a bit more about these findings, the 2 systematic reviews are listed below, and you can also find them on our website, gottransition.org. Next slide, please. So this group is probably very well educated in transition definition. I just wanted to throw it in there just in case. but we define healthcare transition as the process of moving from a, I usually say pediatric, but from a child to an adult model of healthcare with or without a transfer to a new clinician. And the goals of this process is to improve the ability of the youth or young adult to manage their own health and effectively use health services, and to also have an organized clinical process in pediatric and adult practices to facilitate this transition preparation, transfer of care, and integration into adult care. And we also like to emphasize that transition is not just the transfer or the planning alone. It's the entire process of planning, transfer, and integrating into this new adult system of care. A lot of people don't necessarily focus on all three of those areas. So our team at Got Transition likes to reaffirm that with all of our audiences, that all three are equally important. Next slide, please. And in case you hadn't heard, in 2011 and in 2018, there were medical professional societies that signed on to the agreement on the clinical report for healthcare transition. Those groups include the American Academy of Pediatrics, the American Association for Family Physicians, and the American College of Physicians. And they have created this algorithm for each age group of what should be going on in terms of transition. The recommendation is that all three aspects, so that planning, transfer, and integration, are focused on, and also a quality improvement approach utilizing the 6 core elements is a best practice. And in case you want to learn more about the 6 core elements, that is on our website, gottransition.org. I decided not to do a detailed dive into the 6 core elements for this presentation because we will be focusing on the school examples. But if you want to learn more about how to implement the 6 core elements, what tools and samples are offered, and any of our guidance, that is all on our website in both English and in Spanish. Next slide, please. So here we're going to dive into some of our DC work, and the first will be a school-based health center pilot that we did back in, I believe it started in 2017 and it finished up in 2019. Next slide, please. Oh, and by the way, there is a peer-reviewed article that summarizes this work. In case you're interested, it was on the previous slide, and you can look up that citation. And it's also, oh, there it is. It's Healthcare Transition in School-Based Health Centers, a Pilot Study. And I want to say that article was really exciting for us to do because not a lot of the school-based health transition work is published in peer-reviewed journals. So it was nice to get a academic journal to highlight this work, and we hope that this helps spread the ideas and share the outcomes of this work. So please check that out if you get a chance. Next slide. So just to give a little background on these efforts. So like I was saying, a couple hospital systems in DC have these conglomerate groups of school-based health centers. And so we worked with 5 different schools. And they're listed here: MedStar School-Based Health Centers in Anacostia and Roosevelt, and the Children's National Medical Center School-Based Health Centers at Ballou, Coolidge, and Dunbar. And with both of these practices, we met with the school-based health centers regularly in person to not only customize the tools for the pilot, but to also provide regular coaching on the use of the tools, get updates on how things are going, and feedback. And so the first step that we always take is to select and customize specific core element tools and get input from the school-based health center staff and the students to really understand what would be used best for that student population. So what ended up happening is in all 5 of these schools, we did do the 3 bulleted tools that are listed here. We created a welcome and care policy poster. We completed a transition readiness assessment, and we also created a finding an adult doctor resource. The next step was to always determine what clinic process worked best for implementing these tools. We also suggest creating some sort of workflow so you know who is handing out this tool, when is the student receiving it, once it's completed, where does it go? And then is the information recorded into some sort of medical record? And is there any follow-up or education that happens with each of the tools? So we would always try to figure out a smooth clinic process for implementation. And we also like to think that this process needs to be sustainable. So without our team and without the main lead quality improvement team person helping out with the process, does it still happen? That's always something that we like to think about. And then we also make sure that we measure the baseline and annual progress of the pilots so we can see what improvements have been made and if it's actually improving anything. And finally, we make sure that a lot of these tools will provide an education session on students' self-care skills after the use of the tools. So I'm going to give some more specific examples if we could go to the next slide. So this is how the tools were used in some of the schools. The welcome and care policy was blown up into a big poster that included the school colors, and they were put up in the waiting rooms and the exam rooms, and smaller versions were used like handouts, and they were given out at the front desk of the clinic. The transition readiness assessment was conducted as part of the routine preventive care visits, and the results of the readiness assessment were recorded into the EMR. I will note that in some of the schools, they do give the readiness assessment a little differently. In one of the clinics, they use iPads as part of the waiting room sign-in, and they included the readiness assessment electronically in the iPad as something to do for the student while they wait in the waiting room. At some of the other schools, they do it as a hard copy, and the paper of the assessment is given to the students as soon as they're in the exam room waiting for the provider. So we've seen it in a variety of ways, and no one way is correct. It's just what works within the school-based health clinic system. We also complete a resource sheet of adult doctors locally, and it includes health clinics, doctors, sexual health websites, and a mental health helpline. And this resource document is shared with seniors who are about to leave school. This is something to tell them, hey, this is your last visit with us. Here are some tips and local resources to get you geared up for life post high school. So that resource is something that usually takes a while to complete because we try to make it as specific and tailored to the locality and the student population of that school-based health center. And I'll show you an example of one in a bit. And finally, for health education, we do a variety of things based on the schools and the school's resources, but sometimes it's a clinic tour, sometimes it's self-education, targeting carrying health insurance cards. There's a mock mega doctor's appointment session, or information about refilling prescriptions and entering your health information on a cell phone. We've also done school assemblies where we would go to the school while the seniors would have one of those senior assemblies where they get information about graduation and prom. We would kind of have a 10-minute spiel about the importance of healthcare transition. And this was a nice time because it addressed all of the seniors that were in the room. And we gave them we would also present a little video for students on healthcare transition and what that means for them. Next slide, please. So here's an example of one of the welcome policy posters. So as you can see, it's the school colors of Coolidge High School. And we gave a little brief description of what happens when a student comes to the clinic. We gave information on how to access the clinic. So open hours, phone numbers, how to make appointments. And then there's some brief information about mental health and sexual health privacy, parent consent, and also a resource also noting that we can help find a new doctor from the high school clinic. And this poster and handout was kind of a nice thing to give to students at the beginning of the school year. Some schools gave it with the orientation package, so the parents would definitely get to see it. But we definitely tried to have this handout be visible and accessible to students in a variety of ways and throughout the school year so that they were always reminded of this information. Next slide, please. Here is an example of the Finding an Adult Doctor resource. This is just the first page, but we give a few steps on how to find a new adult doctor with some considerations to think about, and then some questions to also ask yourself when thinking about where to go for healthcare after high school. So some things listed like the second question on the second half of the sheet. Where is the doctor's office or clinic located? You got to know where it is, and you have to think about whether it has a parking lot or if it's near public transportation. You want to also think about if they have walk-in options available or if you need to make an appointment always. So just some basic 101 information that helps students think about the right things before going to their first doctor's office appointment outside the school. And the next slide is I believe the second page of the document, where we have mental health and sexual health resources. And these are also local DC resources. So the first is about sexual and reproductive health. And the second part of this document is the mental health resources that are also local to DC. You will see at the bottom of this, we say, please see the next page for local clinics you can contact. So the third page of this document is I don't think I put them in the slide, but it's a full list of resources or of clinics that were in the 1 to 2 mile radius from the school. Given that most of the students were living in that area, we thought that would be most helpful. So we listed about 12 clinics that were in that radius, and then also several clinics that were located a little further out of that radius, just to give the students as many options as possible. Next slide, please. Oh, I did include it. So yeah, you'll see these are those addresses. And next slide, please. Now I'm going to walk you through our school-based mental health program that happened in DC through Mary Center, which is a federally qualified health center serving DC and Maryland. Next slide. Thank you. So in working with Mary Center school-based mental health programs was a really great experience because it was the first time we customized our tools for a school mental health population. So we worked out of several schools in Mary Center. I want to say they have 4 or 5 schools that they have this school mental health program at. And we worked with a group of therapists and community support workers through Mary Center. Oh, sorry, I wrote based at 3 of the schools. And we piloted this program. And we would meet monthly with their team to customize the tools from the 6 core elements. And we also made sure to get student input on the tools before establishing a process for utilizing each of these tools. And we piloted this with 25 high school seniors from September 2018 to September 2019, so 1 school year. Next slide, please. Again, we created 3 tools, customized 3 tools for this population. We have the readiness assessment. We also created a mental health glossary of terms. And finally, we created a post-graduation wellness plan. Next slide. So here you can see the mental health transition readiness assessment. It might look familiar to you if you know GOT Transitions readiness assessments. We customized the questions to address mental health and behavioral health services. And the goal was to have the seniors complete this twice during their school year, twice during their time at the school, once during intake and once right before they left the school in the spring. The therapist would administer this assessment and sometimes would complete it with the student. And we were told that it enabled better understanding and planning between the student and the therapist. I'll just read out a few of the questions and walk you through the layout of this real quick. So it starts off with general information about the student, and then it goes into a scale 0 to 10 of how likely and how confident the student is to continue therapy after high school. There's no wrong answer with this, but what it enables is it allows the therapist to understand where the student is. And if you conduct this assessment more than once, it also helps understand if they've changed their likelihood and confidence over the course of being a patient with the school-based health center. The first section is related to their mental health. So some of the items are, I know what stresses me out and how to avoid or cope with it. I know what to do in case I am in a crisis. And all of these questions, we include a yes, I want to learn, or a no option. And the student can check box which one of those fits most accurately with each of the items in the assessment. And the next section is on accessing mental health services. So it's, I understand that when I turn 18, I have full privacy in my healthcare. I know I have to get my own health insurance at age 21. It's all about the health service. And finally, if a student was taking psychiatric medication, they can fill out the last section about their medications. And the idea here is that a therapist would be able to look at the items marked with I want to learn or no, and work on those, and they can prioritize a couple of those as a goal to work on with the student and just to hone those skills over the course of their interactions. Next slide, please. We also created a glossary of terms, which was used as a resource for reference for students during their sessions with the therapist. And if they didn't know a term, the therapist would pull this out, and it would kind of give students a better sense of what was going on in some of the vocabulary used to build their health literacy. Next slide, please. And this is a post-graduation wellness plan that for the first time we created for this pilot. And this allowed for kind of an interactive exchange between the student and the therapist about their future mental health needs. So it was completed and given to the senior in the spring before they left the school. And it includes information about planning for your future services, emergency mental health info, relapse prevention, and wellness planning. And some therapists said that it took a couple sessions to complete this post-graduation wellness plan. It's a few pages long, but it definitely addresses future mental health planning. So if you are attending college, what are the services offered? If you are not it's not shown here, but if you're not attending college, what are the services offered? And then it asks you whether you have strategies to cope with any crisis, and also some emergency contact information. Next slide, please. So we got some great feedback from this pilot. Students said it helped them open up a conversation about their needs and their skills. It helped them be proactive, and they appreciated the process and felt more empowered over the course of the year. And we also heard from therapists that it helped them plan ahead and not wait until discharge to figure out the needed next steps. It provided a structure to talk about a student's future plans proactively. And most therapists were on board with the pilot, but a couple found the extra paperwork a bit burdensome. And in subsequent pilots, we have tried to work on that definitely and try to pare down the paperwork and think about how we can make the process more simplified. Next slide, please. This program also had a large sustainability component included in it. So after we did the pilot session, it was integrated into some other school-based mental health programs, and now it's in a total of 7 schools in DC. And they also embedded transition as a best practice in their therapy infrastructure and included it as part of staff onboarding. So when a new person comes in, they have to read about the process of the transition clinic process and what tools are included. So it was nice to know that this project is still going on in those schools. Next slide, please. So here we are talking about healthcare transition and special education, and this ties in well with what Tim gave us some great background info on earlier. Next slide. So I'm not gonna, Tim did a much better job defining IDEA to us, so I will skip this slide. And we like to always open up when talking to families, especially the importance of health. We always like to say that in the IEP planning process, there's room for employment planning, independent living planning, post-secondary education planning, but none of these can actually happen successfully if you're not also planning for health. This is an important piece of the puzzle, and it should not be overlooked. If you're unhealthy, you won't be able to work or live independently, and it's hard to maintain your secondary education programs if you're not also maintaining your health. So we like to keep health in the focus here. Next slide. So there are two tools that Got Transition created in order to address this gap. The first is a healthcare readiness assessment for specifically the IEP. And the second is a cheat sheet of sample goals that the IEP team or the special educator can use in the IEP transition plan. Next slide. So here on the screen is the transition readiness assessment for these students. As you can see, it's in a similar format as our other readiness assessments, but you'll also notice that at the top, there are some additional questions about personal care and communication supports. And then in the sections on my health and my medicines, we have modified these questions to address students in special education. And we had focus groups of special educators and parents review these tools to tell us whether if a student were to answer, I want to learn or no to any of these items, would a special educator be able to answer these questions for them? And after many months of vetting, these were the final question items that we landed on. Next slide, please. We also have the cheat sheet here on the screen. So as you can see, this is a document where the left-hand column that says My Health is actually the items directly from the readiness assessment. And we have drafted a sample goal for each of those items on the right-hand column. So this can be used to add into the IEP transition plan. Next slide. And on the back of the document, we have the section for my medicines on the left column, directly taken from the readiness assessment, and on the right-hand column, sample goals. Next slide. Here, I'm going to walk through a quick example. So here is our readiness assessment. Next slide, please. And let's say a student has marked no for the item, I know or I can find my doctor's phone number. Next slide. We can pull up the cheat sheet here. Next slide. And here we are locating that item on the left-hand column and then looking at the sample goal. It says, by the end of the IEP cycle, student will name and identify their doctor in their phone when asked with blank % accuracy. On the next slide, I will identify a couple ways to achieve this goal. So here are some ideas. You can work with your youth or young adult to add their doctor's name and phone number into their phone contacts, or use Got Transition's medical ID resource, which allows you to follow steps to add your health information into your smartphone, including emergency contact info. And then you practice this skill. Once a week, once a month, a student can be asked to pull up their doctor's phone number or contact information in their phone. And this can be worked on and then evaluated and updated in the IEP transition plan. Next slide. So those are our two IEP tools, and I will quickly show you where they are landed in our website. Would I be allowed to share my screen very quickly? Awesome. So, all right, so this is Got Transition's homepage. It's gottransition.org. And just on the homepage, I'll let you know that we do have all our latest news and announcements. We recently came out with an HCT 101 video that's made for youth and young adults. And we actually made it in collaboration with our youth and young adult advisory group. So it was an awesome time to put together, and it's a really good watch if you haven't seen it yet. We also have some infographics about our resources and some easy quizzes to take on healthcare transition and if you are ready to be a healthcare transition expert. Now, these school-related tools are located at the top. If you hit resources and research, we have a tab called special populations. So you're just going to want to go to that. And you're going to scroll all the way to the bottom. I mean, you can also take a look at the other resources that are there, but for the school tools, you're going to want to go all the way down to school health. So we have the special education section, school-based health center section, and the school-based mental health section. I will also say that the tools I showed in the slideshow today are a bit older because we've had a lot more pilots since those were going on. We recently completed a large-scale mental health initiative with schools in Prince George's County, Maryland. And I will say this resource is awesome. We made a toolkit out of the tools. And for each of the tools, and you will recognize some of them, but for, let's say, the readiness assessment here, we also made a cover sheet for each of the tools that tells you the goal of the tool, the audience, and how the staff team used the tool. And this layout is repeated for each of the items. We also had a parent transition readiness assessment. That glossary of mental health terms will also appear. The post-graduation wellness plan is also here. And all of these items are clickable and fillable, so they are very compatible with remote learning and virtual therapy sessions and counseling. We decided to make many of our tools clickable and fillable during the pandemic because that's what you need. So yeah, that's pretty much my spiel today. And I'm happy to answer any questions or pull up anything that you are interested in. My email, as well as Peggy McManus's email, is on the screen, and you can also follow us on our social media accounts. We are on Facebook and Twitter.
And I want to thank Samhita, Tim, and Julie for sharing with us today. Wonderful information. Like I said, please take a moment to fill out the evaluation. It really does help us out to make our learning community even better. And we hope that you will join us for our next learning community, which is on March the 10th, 2022. Thank you for your participation. And that concludes our presentation.
Thank you.
Samhita, that was perfect. Thank you.
It was fantastic. Yeah.
Oh, she popped off on us. Okay.
Great information.